Okay, so as far as I know, yeah, I think so. Be free to start if you want. Okay, so it is 5:30, and I will call this meeting to order. Welcome, everybody. Nick, do we have a quorum?
Madam Chair, we do have a quorum.
Okay. Mine's Nick. Hopefully he'll show up. So let's stand up and say the pledge. Are you up for the next?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. So I don't know the proper protocol. Is it okay if I just pray?
Yes.
Of course. Okay.
Of course.
Okay. Father, we thank you for this day, and we thank you for the opportunity to serve the hospital and the community. We just ask you for help and your wisdom and your guidance. Okay, 16. Thank you. Okay, so, oh yes, did I say that?
I did.
Thank you. Okay, so the first thing I had on the agenda was to talk about board training, and I don't want to make any decisions necessarily today, but I would like to talk about whether we as a board want to, I think it's important that, I think we should get board training at least from Allison for an hour or two, however much she thinks she needs to give us. That's one thought, and then the other question is whether we want to have a board retreat and do some board training. So I'd like to hear everybody's thoughts on that. And I guess it'd be helpful. Oh, there's Steve. Well, I mean, for a retreat,
Can you speak up, please?
For a retreat, what would you have in mind? Well, so I have never done a board retreat, so I don't quite know how to envision it. Okay. Mary was telling me yesterday that she has done one on a different type of board. So I can kind of find out these things, and then we can talk about it if you guys are interested. If you're not interested in a retreat, I don't want to figure it all out.
I think Allison's training would be very good for the board, and however long she thinks.
Right, yes.
But also, at that time, maybe the suggestions from her on a board retreat would be helpful too. Okay. And maybe the board would have a little more idea of what they would think they would need. Okay. And I'm not against the board retreat, but I think the training, as quickly as we could, would be helpful. So then, the question also then is, do we want to do that training before our next meeting? Before our next regular meeting. Right, before our next regular meeting. Yes.
May I ask, it's Mary, could you tell us what your experience with the board retreat is? Because like if we're talking about 2 weeks in the country saying who I got over at campfire, I don't want to do that. But if we're talking about
2 weeks in.
But if we're talking about gathering together like a work session, I think that'd be great.
This was, the high school principal took the high school teachers to Ranche, and it was a 2-day thing. There was some training, and there was also some collaborating, not games, I don't want to say games, but things that we had to work together, get to know one another better. It was kind of a collective, and she did that for, I think, 2 or 3 years. At first, people were kind of resistant, but towards the end, it was a good thing. And she did it right before school started. That's the only thing that I've ever done.
Madam Chairman,
Yes.
can you hear me?
Yep.
So, some of the ideas I could throw out if you wanted to do a retreat, it could include training or not. It could include looking at strategic planning, which is something normally that a board like yours would undertake with the CEO. Setting goals, strategy. I think it is also helpful to have a meal together, dinner, right, the get to know you part. I've seen it a day long for some hospital boards and a day and a half for others. And I would suggest for your first one, maybe you do a day with a dinner and that would be sufficient. Or even a half day, but just to start somewhere. And I know you had discussed the bylaws and how there were things that certain board members wanted to have changed in the bylaws. That would be a really great place to build in a workshop piece like that to discuss, have a little more time to discuss something that would take time to collaborate. So, thank you.
Thanks, Allison. So, what's everybody think?
I would like to say one thing. I think that it would be important for us as a board to have a training on Robert's Rules of Order. I think we need that. To get a little decorum and order to our meetings.
Right. Yeah, we can include that. So, which would we rather? Would we rather do one shorter one that Allison does, and then a half day or a whole day a little bit later? Yeah.
That would be my suggestion.
Chunk it up, kind of.
Yeah.
Maybe one with Allison, like you said before, the next meeting for 1 or 2 hours or something.
We do like a board education for a meeting or two. I mean, I don't know how long the training will last, but
Allison, how long do you think it would last to do, like, what would you rather do, especially for these new members on board training?
So I would suggest that a training for new board members might take an hour and a half. Usually longer than that, I start to lose people. So, and that would include about an hour of review of some of the things that I went over in that presentation. There are some additional ones on Stark, anti-kickback, and just healthcare compliance issues that would probably be helpful, and then Q&A.
Yes.
So I think it would be helpful to have a retreat here, because I think part of the orientation that, I mean, I would love to do more of is visiting the different departments and visiting the lab and seeing it, and visiting the laundry and seeing it, and visiting all of the departments within the hospital. And I think that if we could do kind of a retreat here, and incorporate visits with all the departments, I think that would be very helpful.
Okay, I think somebody should make a motion and put all that into order. And I will,
Madam Chair, I would move that we do a board training lasting, depending on what you would like, an hour and a half to 2 hours before our next regular scheduled board meeting.
So
And then
directly before the next regular schedule?
directly before. And then at that time, consider a retreat. I've heard some really good ideas, and I think part of the retreat of visiting, like you said, would be very helpful. And I don't know that we can get, I'm sure part of the board training will be Robert's rules, or include some of that. And so I
Sorry to interrupt, but I actually am obligated for another meeting during that time
Okay. Have to
that
get,
I cannot move, so, sorry.
okay, thank you for telling us, Allison. Okay,
Yeah.
Okay, Madam. Okay, Madam Chair, if I may change my motion, I move that we leave the time and place up to you.
okay, so we need a second.
I'll second.
Okay. And all in favor, or any more discussion? All in favor, say aye.
Aye.
All opposed, say. Okay. Okay, I will work on that. Make a list of my jobs. Okay. I'll get together with you, Allison, and just figure out when you're available.
Great, thank you.
Yep, thank you. Okay, now, Randy, do you just want to talk briefly about the clinic manager?
Yeah, so the clinic manager is for the rural health clinics, and there were 5 candidates total. There were 2 in-house from the clinic and 3 out, one from Newcastle, one from Custer, South Dakota, and one from Buffalo, Wyoming. And out of all the 5 candidates, we feel that Deborah Risser was the best. We had good candidates, but we feel Deborah Risser was, the one that was chosen for that position. But please take time to review, comment later on, get back with us on what you think, and if you want to interview her as well, you're more than welcome.
So you haven't hired her, right?
No, we haven't even made an offer.
Okay, and you're giving us the opportunity
Yes.
to be involved in the interview?
Right.
Is that something that the board likes, that idea, or what's you guys' thoughts on that?
I had 2 thoughts. First of all, I love the idea of us meeting her and having a say. My assumption when we're given the opportunity to meet her is that this person would be part of the leadership team, the management team, that we would have to approve.
She actually wouldn't be part of the leadership team since she's just a manager, not part of the top leadership team. She would be the manager of the clinic.
Okay, and then my other question on that note is, this is a non-budgeted position, it's a new added position, so I would think that the board should be having a discussion on should that even be authorized or added before we talk about candidates, because we've never approved the position or the funds to pay for said position. So I think the candidate should follow after that. Does the board feel that we should have a discussion about adding this position?
What does the bylaws say on a position like that?
So the bylaws, there's 2 things going on. First of all, the bylaws only state that the board would have, has to approve a change in the leadership team. However, the bylaws also state that anything that is not in the budget has to be approved by the board, and this isn't in the budget. So while the actual position falls under operations, adding the position would fall under governance and this board. And we haven't talked about it or done that. So, does that make any sense?
So Randy,
Yes.
when were you hoping? So obviously we would have to discuss this as a board to
Right.
make the position. When were you hoping?
I would say within the next 30 days, because we had talked about it in the previous board meetings about the need for a clinic manager over the rural health, which also includes Newcastle as well. So the importance of that.
Would it be just this candidate that we would talk to, or would we talk to the other ones that had applied?
How the board wants to do. Yeah.
Which one is it?
I mean, it's operations, but I've given you guys the opportunity to play a part in that as well.
And we appreciate that. However, I've been asking for a year for some kind of idea of numbers of the clinic. We don't even know if we have enough money to keep the lights on, never mind hire more staff at the clinic. So my question is, we need to understand the financial position of the clinic before we go adding staff to the clinic. We don't know the volume numbers, we don't know anything about the clinic, and I've been asking for that information. So I think until this board gets that information and can have an idea of the revenue and the volume of the clinic, we can't make a decision on if we need to add staff to the clinic.
And it would have been interesting to see how many votes may have changed because of Gordon's actions, because of the response of their communities after those bills were passed, specifically the gun-free zone bill. I think that we would have very much seen a change in votes on that one. I think you would have seen more nay votes on that than you had before.
So you're saying that that some folks were counting on the governor veto in that one?
I very much 100% think that especially school districts, courthouses, places like that were banking that the governor was going to go, no way are we letting guns in these areas. And I think that their response afterwards may or may not have swayed some of those representatives and senators to vote a different way because the response was strong.
I think until this board gets that information and can have an idea of the revenue and the volume of the clinic, we can't make a decision on if we need to add staff to the clinic. Does that?
I totally agree. From the finance standpoint, we really need to get our hands around what's happening at the clinic before we start expanding more expenses. So I do agree with Gary on that point.
I agree as well. I think we have to discuss whether or not, and try to get some financial idea whether or not we can afford the position.
So we need more discussion.
We need more discussion.
So is there an acting manager right now?
I know what you said.
No.
Is there an acting manager right now?
No.
No. Okay, so how do we go forward with this?
I mean, I don't doubt there needs to be some clinic reorganization, but we need some idea of numbers to do that, Randy. We really do.
Just like hiring the positions. We're looking.
So, do we need a motion on this?
Just for more discussion.
No. Okay. So we have, is it 2 weeks? that we have our-
I think two things can be done at the same time. Like Randy can be working on numbers and we can meet this person and then we can decide based on both if we want to move forward. We can do both things at the same time, but I'm just saying, as far as I'm concerned, without some kind of idea what the finances of the clinic look like, I can't authorize hiring a manager, but I can meet the person. Is that?
Is that in our scope though, to even authorize it at all? I mean, is that clearly your?
It is my decision from an operations standpoint.
That's what I'm saying, like, we don't, what authorization do we give other than just advice and guidance?
So,
That's my question, I don't know.
you're right,
Yeah.
but we are also the governing board, so if it's a non-budgeted position, it's adding a staff member that we don't have. He's fully authorized to replace positions that we already have, but he's not authorized to add positions unless they're in the budget, and we haven't authorized the adding of a position yet. That's what I'm saying.
So this is my suggestion, if we need to, so I think what we should do, and you guys can all chime in, is I think we should plan on meeting her, if possible, at our next regular board meeting. And I think that the finance committee we should work on
The numbers and.
the numbers and stuff like that.
You know, the true numbers as far as.
Yes.
Reimbursement, investment numbers, the patient percent, the body.
So does that, so are we good? Okay. Okay, so, now it's time for visitor comments. Do we have visitor comments? Okay, we have just one. Okay, okay. I just want, before anybody says anything, I want for you guys to remember that we have a lot to do after visitor comments. So, anyway, okay, go ahead.
I'm Pam Walteri. There's a couple faces in here that I don't know. I wear many hats in this community, and one of my hats is mayor, and it is to protect my community. And with that, I went back into my career as working up at the prison and my training as a background investigator. I used that experience to research some information that I would like to share with the board that's very concerning to me and to possibly our community.
I move that we consider this information during executive session. Do I have a second?
I don't know.
I had a hard time hearing what you just said, Nathan.
I'm sorry, Allison, I'll try again. I move that we take Ms. Pam at her word that she's a credible member of our community, and that if she thinks she has information of relevance to our proceedings today, that we should hear her out.
I think we should hear out. Do you have a preference for it to be public versus private?
I don't have a preference.
So generally, information about employees is not discussed in public session unless requested by the employee.
And we're set up working as well.
Yeah, I don't know, that, I guess Pam hasn't said what it's about, so I don't know if it's public or private, and I don't know what to do with this.
So give us more information, Pam.
I did some research on your CEO, Mr. Randy Lindauer.
I personally would rather hear that in exec.
So do I have a second for my motion? That's what your motion.
Your
Yeah,
motion was.
As chair, I can't second.
Yeah, my motion was to take Ms. Pam at her word that she's a respected member of our community with very good research abilities, and that we should give her a fair hearing during our executive
So
session.
this is public comment, and public comment should not be made regarding employees.
Right, we're not proposing to do so. I'm making a motion that Pam can share with us information she feels is germane for the topic of our executive session, floor today.
Maybe you should finish public comment first.
Does anybody else have any other? Oh, okay. Would you, so how we're gonna do it, say your name, and I would appreciate it if you'd be as brief as possible.
Absolutely. I'm Megan Stitt, and I'm a person in this community that was born and raised here. I know almost all the faces, I believe, in this room. I left for a number of years, and I came back because it's a community that I genuinely care about. I know I'm just a community member, but I would like this board, when you go back into executive session tonight, to know that I know Piper came back to this hospital with nothing but good intentions to keep good health care for our aging community and anyone that needs emergency care in this town, as well as clinic care. And as far as I know, she's kept that mission in her heart and truly cares to have a community with a manor, with a hospital, with a clinic, with doctors, nurses that are available to care for our community. And I think that's important to us. And I'm highly concerned as a community member with a person coming in from outside our community who doesn't know anyone here, who's just wildly spending money from a hospital that doesn't have money from my public, from all I know. And I would just urge you very strongly to take that into consideration in your executive session tonight.
So for the rest of these comments, we are gonna keep them. So we want to hear your comments, but let's not get digging into people, okay? First, we don't want to be, I'm just gonna shut you down if it gets mean. Okay, go ahead.
Tracy Jones, I'm not gonna get mean.
Okay.
I just wanna know if you guys have sat down with Piper yourselves and heard her side of the story.
I have.
Yes, you
I
have?
I've spoken. with
Anybody
Piper
else?
On a couple of occasions.
We are hoping to do that tonight.
Were you gonna do that last time and that didn't happen? She came in there and nothing happened. So she will be able to speak tonight? Let's hope so.
I'm Stephanie Liska, and I would respectfully request to be heard in executive session because I have comments that directly concern an employee.
Okay, we will discuss both of those issues at the same time. Any other comments?
As long as we're talking about money and spending money here and there, I heard that, well, I was reading back in some of your minutes and stuff, that you're paying somebody $32,000 a month for HR. Is that true? She's making $32,000 a month? Is that really, I mean, do you really need her for that kind of money? And we're broke? I just have a huge concern there. That just seems like a waste of money. And it seems like that's all we're doing is wasting money. I am so happy to see H&H down the road. They should have never been hired in the first place.
Anything else?
Okay, so I guess I'll.
Yes, you see the comment. I personally do not know if there'll be a vote after the session. We won't know until during executive session whether we have a vote after the session.
So I guess to make things even more awkward, I'll make the same motion. I think is this third time?
So
I guess we can call it
Look,
Brit and
so-
stuff.
I wonder, Allison, give me some advice here. Can we,
If you make a motion, I second it, then we can discuss it, right?
right, yeah,
Okay, so
sorry.
make the motion. I'll
Okay.
second it and then.
Thank you. All right, for the fourth time, I'd like to make a motion that we accept Pam's proposition as as a respected member of our community to speak important information to us in executive session that is germane to the purpose for which this meeting has been called.
I second the motion.
Okay, so now we can discuss.
So we have somebody else that wants to.
Right, I was just gonna say.
Can they address that?
I
So,
also, yeah, so should we
wait,
deal with this
let's
first
just
one?
talk about the whole thing first. And then, so my concern, like from what I would guess from Pam's things, I think it'd be better, like I believe that it'd be better in exec. But I also do not, I know we've got a lot to get done in executive session, and I don't want that to get hijacked by visitor comments. So, but I'm not the only one to talk, so let's.
I have a question. My name is Jennifer Smith. If you open it to public comment and the public is here to comment, why are we not allowed?
Right.
I would suggest asking legal counsel.
I think.
I can barely hear you guys, so.
My suggestion was to ask legal counsel their thoughts.
The reason that you don't discuss employees in public session without their permission is because it could be harmful to them in their employment.
I would, Madam Chair,
Yes.
I would tend to want to vote yes to Nathan's motion, just because I wouldn't want someone's name or reputation to be disparaged in a public meeting. I guess I would want the board to decide if it's valid, if they think it's valid and want it to be heard in public session. If it's about an employee,
I just feel that if
I
that
don't know.
employee has nothing to hide, then they shouldn't worry about
Okay,
it.
stop.
Okay, I think that we should hear for a certain amount of time, maybe 15 minutes or 20 minutes or something from Pam. I think we should hear, am I correct that you're also an ex-employee?
No, I am a current employee.
You're a current employee.
And mine will take 3 minutes, and if you want, I can do it in public without naming the employee and just make a statement.
I would suggest that my recommendation or my thoughts would be that we would hear them both in executive session.
What do you think, Mary?
I think that's a good idea.
Great, exactly.
Okay. Okay, so are we ready to vote then? Nathan, restate your motion.
Should we combine the two? Should we combine Stephanie? Okay. So I'd like to make a motion that we give Pam and Stephanie a hearing during our executive session this evening.
Okay. All those in favor say aye.
Aye.
Those opposed, same sign.
Yeah, there's no discussion.
Oh, I'm sorry. I wasn't.
If I may.
I did look down that row and didn't go that way. I'm sorry.
I have no problem with the motion in the second. And the idea, as long as the two individuals have their say, get a chance to have their say, and but at that point in time, they leave the room or we have discussion.
Absolutely. Absolutely.
That's the only thing I would like to know.
Does that sound okay, Pam and Stephanie, that when we're done, you agree?
Absolutely.
Okay.
Okay. So let's do that vote again. So all those in favor say aye.
Aye.
All those opposed, same sign. Okay. Okay. So somebody, do I move to go into executive session or does somebody else?
I'll move this.
You should have a board member move to the reasons set forth and have them read the agenda.
Okay.
I move, we move into executive session under 16-4-405, to consider the employment or dismissal of an employee or to hear complaints or charges against an employee and to consider or receive any information classified as confidential by law, including legal advice.
I second.
Okay, everybody in favor of going into executive session?
For me, both of us, whichever.
Say aye.
Aye.
All those opposed, same sign. Okay,
Can you state the statute, please?
the statute is 16-4-405A2. Or I.
II, and it's also IX, is it not?
It doesn't.
Okay, thank you.
Oh.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.